Americans have a 1 in 5 or 20% chance, if you can believe it, of developing heart failure in their lifetime. And part of the reason that this is so common is because the conditions that can contribute to development are also very common. These can include blood pressure that's elevated, that's not been well treated, blockage in the arteries that goes to the heart, also called coronary artery disease, which can cause heart attacks, and other conditions that contribute to heart health, like diabetes and obesity. Heart failure is a term we use when organs in the body are not getting enough blood from an abnormal heart. And so as a result, the organs don't work well and fluid can build up in the lungs and other places, causing symptoms. When a patient is diagnosed with heart failure, treatment involves medications to help protect the heart from working too hard, help patients live longer, and can help the heart get stronger. Pacemakers are sometimes recommended to help the heart work more efficiently, and defibrillators to help protect patients from abnormal heart rhythms that can be fatal. An important part of treatment is teaching patients how to monitor their symptoms and things they can do at home to help control things like following a low-salt diet. Cardiac rehabilitation is an exercise and education program that's offered by hospitals and is now covered by the Centers for Medicare and Medicaid Services for eligible patients with weakened heart muscles. And it's a really great way for patients to start getting active exercise in a safe and structured environment to help improve their quality of life. At St. Luke's, we're very fortunate because we have the full range of cardiac specialists to treat our patients, including board-certified heart failure physicians for those heart failure patients who need us, and the full spectrum of treatments available to them. So if patients don't improve with treatment or they're very sick, we can consider options like heart transplantation and heart pumps, which are also called ventricular assist devices, or VADs. There's a lot of very promising treatment options that are in the research phase of development and clinical trials, and many of which St. Luke's are involved in. Some of those trials involve catheter-based treatments to treat leaky heart valves that can be associated with weakened heart muscles, for which patients would not receive surgery. Trials looking at how we can treat sleep apnea in heart failure patients, which is an important contributor to how they feel, and other options like gene therapy with stem cells for damaged heart muscles. There's a very promising medication shown in recent trials to provide significant benefit to heart failure patients compared with standard therapy. However, it's not yet commercially available. We are very proud of achieving advanced heart failure certification. Only 53 hospitals in the entire country have achieved that designation, and it means that we have met critical milestones as far as performance in the hospital and the clinic setting that have been determined by the Joint Commission to be important for improving outcomes for heart failure patients. The certification signifies St. Luke's dedication to fostering better results for its heart failure patients and our commitment to providing the highest level of care for them. And it should instill confidence in the community we serve. At St. Luke's, we're very fortunate to have a truly multidisciplinary heart team. We can offer personalized care to every patient with the full range of medical and surgical treatments for every stage of heart failure.